This presentation is focused on psychotic illnesses, in specific schizophrenic disorder. This PowerPoint was collectively brought to you by Amy Laws, Gabrielle-Grace, Jaimee, Cohen, Kirsten, Coryell, and Pamela Langan. Throughout this presentation, we'll highlight specific notions that include brief etiology and prognosis, acute and chronic signs and symptoms, needs analysis relating to generalized consumer care dependent on an individual diagnosed with schizophrenia, nursing strategies to enhance the means of a therapeutic and patient-centered care relationship, treatment options, and governmental initiatives. In conclusion, we aim to enhance your knowledge and health literacy by the conclusion of this presentation in an attempt to create illness awareness and assist in supporting recovery process. Schizophrenia is conceptualized as a long-term debilitating psychotic disorder that is reported to appear in both genders equally. Illness prognosis presents with a low prevalence rate. However, males tend to present with an increase in symptom severity at an earlier onset of development at an earlier age. Illness prognosis can be commonly characterized by a breakdown, disruption, and impairment in the quality and ability of one to function in their usual manner. Etiology of schizophrenia is recognized as a complex matter that presents with no single identified cause, rather an array of combining factors. Examples of factors that are reported to enhance pathophysiology development may include, but are not limited to, genetic components, individual development, substance and alcohol abuse, as well as social trauma. Onset of psychosis symptoms usually occur as a result of excess, unwarranted presence of dopamine between neurons. A meta-analysis presents data indicating an increase in global demographic diagnosis with approximately 5.6% risk of suicidality. These statistics further indicate an increased risk of long-term disability and a higher probability regarding the development of secondary complications occurring. As a result, there is a vital importance for an early and accurate diagnosis, an ability to provide consumers with appropriate intervention, and ability to enhance consumer care, safety, quality of functioning. Symptom and natural illness progression are recognized to move through three primary phases: prodromal, acute, and chronic phase. However, not all consumers travel or present in each phase. Dependent on phase progression and symptom development, the consumer can often present with an inability and lack of desire to maintain self-care and the performance and completion of usual daily tasks. Health professionals conceptualize prognosis and ability to provide accurate, times-based diagnosis dependent on the consumer's presentation type, such as paranoid, undifferentiated, catatonic, and disorganized, as well as indicating signs and symptoms in link with illness phase progression. According to the DSM-5, symptom onset may occur in an abrupt manner. However, evidence states that symptom development gradually develops over a period of time alongside the increase in symptom severity. In addition, symptoms are required to sustain presentation for a duration of 6 months prior to practitioners able to provide consumers with a clinical diagnosis of schizophrenia. Symptom description and classification associated with schizophrenia are classified as either positive or negative symptoms. Positive symptoms can be characterized as those that seem to be in excess or distortions of common or ordinary experiences, whereby experience or phenomenon is exaggerated or enhanced to the person's ordinary or usual experience. Such examples include delusions, i.e., illogical or incoherent thinking, and or perceptual disturbances, e.g., auditory and or visual hallucination, disorganized speech, and or behavior. Alternatively, negative symptoms can be described as a deficit in traditional behavior and functioning, meaning that an individual feels a sense of absence or inability to interact, engage, and complete ordinary and usual experiences. Examples may include lack of motivation, reduced level of energy, apathy, inability to indicate action, emotional blunting, and or hypersomnia. When conducting a needs analysis, the practitioner will identify the client's stage of prognosis with the inclusion of a socio-ecological framework and incorporation of the social determinants of health. A consumer's needs are dependent on their age, socioeconomic context, and gender. For example, a young individual with early onset of psychosis needs focus on their living accommodation and their level of connectedness to social support. Therefore, interventions and treatment options are a vital component in an attempt to assist the consumer's ability to regain control of their thoughts, behaviors, and emotions, maintain their friendships, and social lives throughout prognosis. As a result of there being no current cure or prevention, as well as the complexity in nature, areas of focus may include quality of living accommodation, level and stability of social interaction and peer groups, education, primary source of income, and the potential need of governmental involvement such as NDIS. Further, additional components may include access to whole family psychoeducation to enhance health literacy, routine involvement from MDT members to ensure progression of recovery care plan, as well as the consumer's accessibility and obtained knowledge to adequate self-care and management of symptoms, which may include pharmacological and non-pharmacological practice. Ensuring analysis and implementation of the consumer's needs encompasses consumer-centered care, increased ability to maintain control in their ability to live a sustainable and meaningful lifestyle dependent on their individualized and identified goals. Nurses play a vital role in their ability to adequately assist in the management and treatment of schizophrenia and ensure a therapeutic relationship is maintained with a consumer. Within traditional practice, nurses commonly use a biopsychosocial model of care. The primary aim of the module is to involve and advocate towards initiating a consumer's capability to perform educated decisions regarding their health through enhancing individual health literacy. Nurses that encourage and promote consumer participation and shared decision-making enhances an increase in level of effectiveness relating to the treatment and medication adherence or compliance. Such strategies nurses may use to promote a therapeutic relationship can include emotional validation and normalization and an individualized care approach. The nurse plays a role in the responsibility to recognize early symptoms and characteristics indicating illness prognosis and their ability to conduct an immediate and comprehensive mental health assessment. Ability to do so increases quality of patient-centered care and requires nurses to establish trust, rapport, a therapeutic level of communication, e.g. asking open-ended questions, speaking calmly, and clarifying or repeating information, an explanation of the purpose of their role. Health assessment requires nurses to provide a comprehensive, detailed mental health report that indicates prevalent positive and negative symptoms, documentation of mental health history, and determining consumer support systems. Ability to obtain vital information further allows collaboration from appropriate multidisciplinary team members. When developing the care plan of the individual, the nurse must identify gaps in knowledge of the individual and their family, provide education of their illnesses, ensuring the understanding of the individual is increased. Providing psychoeducation to the individual and family is essential to address their uncertainties and reduce the prevalence of anxiety within the individual. Through this, the nurse can also provide support and empower the individual throughout the recovery process to ensure the individual receives the assistance and encouragement to recover and attain their goals. The nurse also holds the role of increasing the individual's access to treatment services or self-management strategies to ensure that the individual has access to resources to assist in their recovery. Remedies available to assist consumers who are impacted by the prognosis of schizophrenia require lifelong approaches, including the use of both pharmacological and non-pharmacological interventions. Utilizing both pharmacological and non-pharmacological implementation assists healthcare practitioners' ability to adequately develop an individualized care plan. The primary pharmacological intervention that is commonly used in hopes to assist in the treatment of psychosis symptoms are antipsychotic medications. Primary antipsychotic medications such as chlorpromazine and haloperidol work to positively affect the consumers due to their capability to block dopamine 2 receptors in an unselective approach, in an attempt to reduce chemical prevalence, activity, and symptom severity. Due to the complexity that is often associated with antipsychotic medications and their high risk for generating adverse effects, medical practitioners must provide and perform routine assessment and ensure correct dose and drug type is prescribed. However, adverse effect profiles are common in a range of typical and atypical pharmacological remedies. As a result, it is important that in addition to medication, non-pharmacological interventions are implemented within the patient care plan. These include psychosocial, psychoeducation, cognitive behavioral therapy, community support groups, rehabilitation, family therapy, and group psychotherapy. Use of non-pharmacological strategies assists in the management of both positive and negative symptoms faced by the consumer, as well as significantly enhancing the consumer's quality of life in areas of vocation, employment, leisure, and life skills. Implementation of good social interventions alongside adequate and therapeutic pharmacological practice can assist the consumer in their ability to problem solve and facilitate an increase of quality of life and overall functioning. The Institute of Neuroscience Research Australia is a non-state controlled research organisation established in Randwick, Australia. This institute guides research in numerous aspects of health, specifically of the nervous system. Neuro prioritizes its ambition and objective on the prevention, management, and cure of illnesses and disorders through extensive research studies. The Schizophrenia Research Institute at NERA is an innovative funded by government grants from New South Wales Health. This institute is recognized as the only medical research organization countrywide that is committed to exploring beneficial information that will help individuals diagnosed with schizophrenia live a better quality of life. This organization coordinates research in numerous aspects of neuroscience. These studies of schizophrenia are conducted in universities, hospitals, and research establishments globally with the main priority of discovering new research and findings that will facilitate the advancement of the management and treatment of the disorder. The SRI has completed many findings through these studies that have contributed to the development of knowledge on schizophrenia. However, the Institute further aims to discover research on the latest and safest medications and to discover more on the intricate etiology of the disorder. The central aims of this initiative are to discover drastic findings in the study of schizophrenia, ensuring that the prevalence of schizophrenia will have decreased in younger individuals in the future. The team of neuroscientists and clinical professionals collaborate with individuals and their significant others impacted by schizophrenia to conduct extensive research on the complexity of the disorder. Their contribution to society has led to an advancement of the lives affected by schizophrenia through the comprehensive studies they have completed in an aim to improve the prognosis, treatment, and cure of the disorder. The objective of recovery relating to individuals faced with schizophrenia is to provoke against the assumptions surrounding the mental illness, while actively advocating for them as well as emphasizing the importance of having a sense of self, ensuring these individuals are not defined by their illness. It is important that we as a demographic are aware of language and behavior that elicit stigmatization. Promoting an environment that supports and acknowledges the increasing prevalence of mental health issues can further assist in an individual's capacity to comfortably acknowledge impairment and alteration to usual ways of cognition, behavior, and well-being. Psychoeducation can be obtained by both governmental and non-governmental initiatives to assist in creating awareness in the relation to schizophrenia and overall mental health. Further, early individual self-detection can allow for appropriate nurse and multidisciplinary interventions to be implemented and the use of adequate pharmacological and non-pharmacological remedies. Prevention of schizophrenia is significant to decrease the prevalence of this disorder. Recognizing approaches that inhibit and impede the factors that impact and make individuals vulnerable to experiencing the onset of symptoms of schizophrenia is a strategy to assist in preventing the disorder. Prevention should also incorporate the development of resilience in children through enabling strong relationships throughout childhood. Fostering a safe environment and minimizing the factors that increase the risk of developing schizophrenia will also facilitate the prevention of schizophrenia in children. Thank you for listening to our group presentation, and we hope you've enjoyed. For any further information, please refer to our reference list, which documents all primary sources used throughout. Thank you.